Namaste everyone and welcome to another interesting Facebook Live session. Did you know that urological problems are more common than you might actually think? From kidney stones to urinary tract infections to prostate issues and bladder conditions, these concerns affect a significant proportion of the population, which is why it's very crucial to raise awareness and seek immediate treatment using the most advanced technologies available today. And we're very honored to have amidst us today Dr. Deepak Raghavan, Senior Consultant Urologist, Robotic and Transplant Surgeon at Apollo Hospital's Greams Road, Chennai. Our doctor will shed light on the latest advancements in urology, cutting edge treatments, and how can we positively impact patients' lives. Welcome to our Facebook Live session, Doctor.
Thank you so much. Thank you so much for having me.
Let us start by understanding what urological disorders actually are. Are they related to organs which are treated by the doctors at the urology department?
Yes, that's a very interesting question. So, urology as a specialty has everything to do with the formation of urine and the passage of urine. So, it basically starts from the kidney and how it is formed, how it is transported down the ureters, which are two pipes which connect the kidneys down to the bladder, and from the bladder out. So any pathology anywhere in this slide is then part of the gamut or is then treated by the urologists. We also deal with adjacent organs adjacent to the kidney, which then come under the spectrum of a urologist, and those include the adrenal glands. So urologist basically is a person who deals with these organs: the kidneys, the ureters, the bladder, the prostate, and the exit, along with the adrenal and a few other areas.
So, what are the most common disorders that you, as an expert urologist, would treat at Apollo Hospital's Greams Road, Chennai, doctor?
So, we being a referral center deal with a lot of complicated issues which are very different from what is seen in the peripheries, and the large proportion of what we see will be complicated stones, complicated renal infections, or malignancies which are complex, starting from kidneys, malignancies in the bladder, malignancies in the ureter. And of late, we are seeing a huge surge of people who are being diagnosed to have malignancies of the prostate. This, along with other than infections, we are seeing tumors. We are seeing infections which are partly treated. So there's a large amount of a large spectrum of diseases that we are seeing, and now we have become quite adept at managing these things, thanks to us being a peripheral center and thanks to us having the latest gadgetries at our disposal.
So, what are the symptoms of these urological problems that people should be aware of, doctor?
So, the basic symptoms that are troubleshooting symptoms, that are red flag symptoms, will be somebody having blood in the urine, especially men. It is not common for anybody to have blood. So blood can be, it can show that there is an infection going on. It can show that there's a stone, or it can be a very silent and a subtle way of showing that there's a malignancy inside. Any blood while passing urine is never a great sign. It has to be chased. You can't leave it. You can have a bladder tumor which just they just have a drop of blood, a little more blood, and then when they pass urine, the entire stream is red. That is a warning sign.
A red flag.
A red flag. The other sign is something like, people having recurrent urine infections, which is not common. One-off event is okay, treat with antibiotics is okay, but not somebody who comes recurrent. And the most obvious is somebody with shooting pain anywhere in their abdomen, where they just can't sit, can't stand, they're throwing up, they started to develop a fever. This will suggest something more acute happening, whether there's a stone or whether there's a blood vessel which has got choked. So these are all, these are all very common symptoms, but which should not be ignored.
So we'll take one disorder after another. What are the most common causes of urinary tract infections, which you spoke about, and how can they be treated effectively, doctor?
So urinary tract infections are very differently seen in children, very differently seen in adults. Again, in adults, you will have different reasons in men and women. So children, we'll start with children. Children have urinary infections for various reasons. They might hold on to their bladder for way too long, they might not pass urine, or they might just have poor hygiene as a cause of infection. Again, children have a slightly lesser immunity, so they might tend to get infections more common. Especially school-going children will get it a little more common. Adults, men generally don't get a urinary infection unless there's a problem. There has to be some reason for the urine somewhere, either in the kidneys, in the ureter, or somewhere in the bladder to stagnate a bit. And if this stagnation is a cause of the urine infection, then it has to be investigated, it has to be treated. Women tend to have other associated reasons for which they get recurrent infection, and that they will have to be evaluated again, similarly for stones, similarly for obstructions, similarly for various other reasons why somebody would get an infection. But any urinary infection needs to be investigated. Just a basic test like a urine routine, a basic test like a urine culture, and an ultrasound, at least to know what is happening. We can't afford to miss something large just thinking that it is only a urine infection. It's just a urine infection. Just a course of antibiotics should take care. That is not how it works, because we've seen people who have deteriorated just because it was not properly evaluated. The treatments were a bit incomplete, if I may say so.
So you're saying that it could be an underlying cause of something bigger?
Yes, definitely. There could be something happening which is the cause of this, and unless we treat that, there will be bouts and recurrent bouts of urine infection which will keep coming and which doesn't get okay. Especially in diabetics, they will tend to deteriorate very fast, and then they will end up in the ICU with full-blown sepsis, and that is scary. All that it would have taken is an ultrasound to see if something was wrong up front. Then we can take it from there.
Speaking of the next disorder, kidney stones, what are the different treatment options available today to treat kidney stones, doctor?
So, kidney stones can be small, can be big, can be something like a concrete. It can look or mimic the horns of a stag. Since term called a stag for the stones, it can be that varied. It can be small, from 3 mm, 5 mm to 7-8 centimeters in size. So each different size and each different position has different. Could be in the kidney, could be in the pipeline that joins the kidney to the bladder. It could be in the pipe, which is called the ureters. It could be in various different places. So the treatment lines, some of them we could medicate and they would come out. But then it depends on, again, the reason why that stone has formed. Many of them will need surgery. So the surgery could be endoscopic, where you do a laser, you do a small, fine scope which you put through the urinary tract, up the ureter, and use a laser and break it. Or, at most we could put a small puncture from behind, again, which is the size of a ballpoint pen, put a laser and break the whole stone. So the treatments are very varied. Some people actually have to undergo something called ESWL, where you give something like an extracorporeal shock wave. You give ray, which is targeted or focused at one point, and the stone just powders. So the various treatments are there for which stones can be treated.
Coming to prostate problems, doctor, what are the symptoms of a prostate problem in the first place? Are there any warning signs? And when should one seek medical attention?
So, prostate is a gland which is there only in men. the prostate will grow with age. There is no medication to reduce the age, so there's nothing we can do about its growth. It will grow. It will cause a slowing in flow. So as the prostate grows, there's going to be a slowing in the flow. They will tend to take a slightly longer time. So elderly people will take a slightly longer time to empty their bladder. They will visit the washroom a little more frequently. Try to empty the bladder. So these are the first signs that there is a holdup. They might come back, feel that there is a residue, and go back again. So there will be a need to void the second time to empty the bladder. These are all the signs that there is something amiss. Other than that, would be the need to get up repeatedly at night saying, I need to go to the washroom to empty. Along with this is people for some reason do not try to meet a doctor and do not have this treated. They will then have something called a retention, where the urine does not drain completely. There is a stagnation of urine in the bladder. And this stagnation can either lead to stones. Any urine, anywhere in the body, if it stagnates, will cause stones. They'll form stones. They can have repeated infections. They can have blood in their urine. Or it could even lead to some form of a renal dysfunction, where the kidneys don't work anymore because the urine is just not coming out. So prostate is something which anybody who has any issues with the speed or the emptying of the bladder should seek medical attention and should get it evaluated. People over the age of 60 should also start looking at something called the PSA. PSA is a prostate-specific antigen, which is a very early marker for a very early stage disease, malignancy of the prostate. So PSA is a test which has to be or which should be included in a master health checkup for anybody above the age of 60. A malignancy of the prostate is something which is very easily cured or treatable. It is better to pick it up early, upfront, than repent later.
Doctor, can you share with us some of the latest advancements in urology that has actually revolutionized the treatment options today?
Oh, so years ago, the only treatment that was available for people with a prostate which has grown and obstructing the flow was to just put a catheter, put a pipe, and say, this is all that we can do. And then science advanced, scientific knowledge became better, and then people started saying that we will operate and remove the prostate gland. But that involved an open incisions. You open, go in, and take out the prostate. With refinements, now, for about 80 years or so, we have all been using endoscopic equipment. You put a very small camera through the urinary passage, through the penile urethra, go inside, visualize the entire prostate which is choking, and then just cut it like how you cut potato peels. Just cut, and eventually there is a huge big opening left behind, and the men are able to pass urine much better. Now of late, we have also got lasers which have come in, and we do something called a laser prostatectomy, where you take out the entire prostate gland using a laser. They do it in the morning, and by evening are all set to go home. So our treatments for the prostatic conditions which are not malignant have started 200 years back, from open surgery, from being just on a catheter to open surgery, now to using lasers, and they go home on the same day, happy as can be.
Which is minimally invasive.
Which is minimally invasive. There is no cut, there is no incision, so they are so happy. From the times when there was any surgery demanded a blood transfusion, to today, at this day and age, where we don't even need blood because it's become so standardized.
Which means there are no scars, there is lesser hospital stay, at the same time recovery is fast.
And they get to have home food on the same evening.
True that. Doctor, what are the treatment options available today for bladder control problem, which you were talking about, such as urinary incontinence, which could be also a problem in elderly people?
Correct. So urinary incontinence in elderlies are generally because of, okay, the men have a different reason, which could be neurological. It may also be because of the prostate, which is not emptying, which is not helping the bladder empty enough. And then this bladder tends to develop a much higher power pressure to try to empty the bladder. And this will lead, even before they reach the washroom, they will have a dribble. So you will find the elderly sort of dribble on the way to the washroom. So these are things which can be medicated. One is you treat the prostate in men, and you give them medication to prevent the bladder from becoming such a high pressure bladder, so which needs it to contract so much that they are able to pass urine. This is something which we see very, very commonly. In women, incontinence is generally because the entire pelvic floor in the elderly woman becomes loose, and then they tend to have a sagging of all the organs. Associated with that comes in incontinence. So one of the most important things is exercise. General well-being, generally good exercise will increase the musculature of all parts of the body, and then these kind of early incontinence can be prevented. But if they don't take care, women who don't exercise, who unfortunately have very lax pelvic floor, will then not have a choice but to have surgery to correct that pelvic floor laxity. Then the incontinence is taken care of. It's permanently taken care of.
So, as you mentioned about the importance of exercise, are there any lifestyle changes that one can adapt to avoid any urological issue?
I wouldn't say exercise or lifestyle modification will change all urological issues, but yes, lifestyle changes help. So, smoking. Smoking is known to be one of the most common causes of malignancies across. Anybody who is a smoker predisposes himself from cancers of the lung to cancers of the intestine, from the stomach, and smoking never does good to anybody. So these are people who can develop cancers of the kidney, they can develop cancers of the bladder. So definitely lifestyle modification where you say no smoking will cut down all these malignancies. Again, people who don't drink water, who they are then going to be predisposed to either urine infections or formation of stones, because not wet water, and they're going to sediment. They're just going to saturate whatever urine is there is going to be super saturated, and they will sediment, and that will form stones. So lifestyle modifications, yes, trying to stay healthy, exercise does help in a large way, where you don't land up reaching not only urology but having to need too many doctors. You don't need that because your lifestyles are healthier. You eat better food. You obviously stay healthier, and being healthy is the best way to stay fit in life.
Doctor, we'll take some questions from our viewers. My father experienced problems due to an enlarged prostate. How do you determine what is the best course of treatment for an enlarged prostate?
So, the moment an elderly person comes to us, what we would typically do is see how big the prostate is. So if the prostate, based on the age and based on the clinical examination, if the prostate is large, we would also like to know, is it benign, where it means that it is non-cancerous, or is it cancerous? So we will start investigation on both arms. So baseline test is something called a PSA, where we do a PSA to see whether it is malignant. If the PSA is normal and the clinical examination is normal, then we will start looking for other tracts where you do an ultrasound and other tests to see how big the prostate is. A malignancy of the prostate is treated completely differently than a benign. So any enlargement in the prostate has to be evaluated. If it's benign, which basically means it's big, what it is, and it is not cancerous, we will first put them on medication to see how it helps. If all the symptoms improve, they don't run to the washroom, they're not dribbling before they reach the washroom, they're feeling better, they're emptying better, their nighttime sleep becomes better, then that will be the best. But there are people who may not respond to this, and for them, we will have to offer them a second line of medication, failing which they need surgery. But if it is malignant, then we will have to do an MRI, make sure that this prostate is a localized disease, and then offer them removal of the entire prostate. It's called a radical prostatectomy. Remove the entire prostate so there is no gland left behind for them to ever have a recurrence of malignancy or a spread of malignancy, which could have been treated if it was detected early on.
Perfect. So the second question is that after her second pregnancy, my 32-year-old sister has developed vaginal fistula. Should we visit a gynecologist or a urologist to treat this issue?
So this is called a vesicovaginal fistula. Typically would occur if the delivery is a little complicated, or there was a need to use an assisted method for delivery like forceps and other things, or a prolonged labor where for some unfortunate reason the labor did not progress as fast. There was some amount of pressure, especially from the baby's head when it is coming out, and there is a pressure on the bladder or when the baby is being born, where they will then develop something called a vesicovaginal fistula. Basically, it means that the bladder has got a hole which is opened into the vagina, and then all the urine which comes from the kidneys into the bladder, rather than coming out normally, would then come from behind or vaginally. This needs evaluation. This needs a surgery for which most of us urologists do various kinds of surgeries, starting from low open surgeries to needing laparoscopic surgeries, and now most of us would be doing a robotic surgery, which again makes the person so much, recover so much faster. They could have been so much happier.
Speaking of robotic surgeries and minimally invasive surgeries, can you provide some insights for us into the future of urology and the upcoming advancements in the field?
So urology has been one branch where we have seen within a span of a decade or a decade and a half, we have seen a massive change in the way we look at or in the way we treat things, all thanks to the medical knowledge which has grown, and thanks to scientific improvement, and thanks to all the newer technologies that we have. 15 years back, 20 years back, we used to be doing open surgeries for real tumors. Now, I don't remember having opened for, unless very, very exceptional situations demand. Most of the cases I have been doing are robotics. So robotics is nothing but you put multiple small holes, go through some instruments, through the port, you go through some instruments inside the body. And it's just like virtual reality. I would sit on a console way away, put on what you see in those virtual reality kind of glasses, get something onto your fingers, and as you move your hand, you can see the instrument move. The only advantage, it's 40 times magnified. I could see a small bleeder 40 times magnified. And the precision, the human hand would not be able to go beyond this. The robotic arms would go beyond. So the kind of dexterity and the kind of stability, the magnification that I get is phenomenally better than what we had years ago. And with those kind of improvements in technology, I would say urology is the best beneficiary in improvements in technology that has happened over the last decade, because we are now having the Da Vinci robo. We are also having other robotic systems and platforms which are coming in, which have changed the way we look at things, the way we operate, the way we give clearances to surgery. And you can see the smile on a person as he walks on the next day. He just breezes through the surgery with a smile, and the fear of surgery and the trepidations, everything is gone. Can see the family smile. And they do very, very well on robotics. So I think, the future is here, and it's here to stay.
Wonderful. Thank you so much, Doctor, for sharing your valuable thoughts on the importance and how crucial is it to raise awareness about various urological conditions and to address them and seek the right treatment at the right time. For appointments with Dr. Deepak Raghavan, Senior Consultant Urologist, Robotic Transplant Surgeon, Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, Doctor.
Thank you so much.
Thank you, viewers.